And a related question was posed by somebody else, which was, after hearing other people's advice here about packing on weight while we can, I wonder if we should be more lenient on the healthy side and give more foods that focus on weight gain. And then they talked about whether it was okay to eat unhealthy foods. So Christina, is this sort of, I need to eat more, but I'm not sure what to eat and what's a healthy diet? That's something which I think we've seen quite a lot of, yes?
Sure. Yeah. I mean, when I see a patient who's losing weight and the objective is to try to help them to at least stabilize their weight, often the approach is to find ways for them to improve their calorie and their protein intake. So that's the general approach, is a high protein, high calorie diet. So when it comes to unhealthy choices, it's not necessarily about having to incorporate, empty calories or junk food, if you will. There's ways of increasing calories through healthy foods, through healthy added fats, such, avocados, nuts, fatty fish, etc. But on another side, I should say that I do spend a lot of my time also liberalizing patients' diets so that they are able to meet their calorie and protein requirements. And that often takes a lot of work and time to explain that, it's okay to have some of those things that maybe you wouldn't have if you were following a healthy diet, but that right now for you to try to meet your calorie and protein requirements, it's okay to have those things, especially if you enjoy them and if you tolerate them, it's okay. Yeah.
Yeah, and I might add something here as I watched my father go through pancreatic cancer and experience extreme cachexia. He definitely enjoyed the freedom to eat whatever he wanted, including all of the things we thought he shouldn't be eating. And it was definitely a unique, I guess, maybe challenge for the family, because it obviously makes sense to eat as healthy as possible, but you can only put on so much weight eating broccoli. And so just from our perspective, as the family, we definitely saw that happen. And I think, there was no way he was going to not eat the donuts when he wanted to, but I think that was probably the right thing at the time too.
That's it. And sometimes it's just really a question of saying, it's okay, you can have that, definitely.
Yeah, I think in these extreme situations, I think the family needs to hear that it's okay, and not just the type of food, but, these are patients who are experiencing nausea, pain, they're exhausted, and some patients will even just want things that they've never wanted before, like almost like a pregnancy type craving, and so they'll jump in the car and they'll drive to the burger joint and eat a burger, or the caregiver will prepare a meal, and as they're preparing the meal, their loved one will actually change their mind and not want it. And that can create even more tension between the patient and caregiver. And so I think just labeling that and putting it out there as, I see this all the time, really helps with the dynamic between patient and caregiver.
I mean, coming back to this idea of healthy or not healthy, I mean, certainly we have had a fair proportion of people come through where there's actually, we talk about conflict, we're going to come back to that in a minute, but there's a sort of, well, is it okay for my diabetes? Is it okay for my cardiologist? People have got other conditions as well, which they've been dealing with often for years. And sometimes there's a whole unpicking process that needs to happen about what do you need now in the context of what's going on now. And that may be quite a different set of advice to what they had 5 years ago when they just had their MI, for example.